On 12 News at 4, we are all about bringing you solutions and empowering you to better your lives. Every day, we bring some of the Valley's most experienced professionals to discuss trending topics on health, ways to save money and improve your financial life, the law, relationships. We even have an expert on pets. And it's not just us asking the questions, we give you, the viewer, the opportunity to weigh in and ask questions too. Now, we're putting all these segments together in one place for you. This is Ask the Expert. The CDC recently issued a health alert about rising cases of what's commonly known as sloth fever. The virus is often transmitted by small flies and mosquitoes. Since August, more than 8,000 cases have been reported, including 2 deaths. 21 cases have been in the U.S. and almost all of them in Florida. Okay, so this is wild. A lot of us have never heard of sloth fever.
Yes.
So what is it?
Yeah, so it's basically a virus. It's called Oropouche virus, and it's spread by things like mosquitoes and midges, which are biting flies. But we generally only find this in South America when people travel. And so what we're seeing is it's travelers who went to Cuba. They must have gotten bit, and then they brought the disease back to the U.S. And it's also carried in sloths and birds and rodents, and that's where it gets its name.
Okay, so what do we do about it?
Yeah, so I think the number one thing is, like, if you are traveling, make sure that you're vigilant and make sure that you use insect repellent, because the best thing we could do is not get bitten when we're traveling. And then the thing I worry about, it's truly pregnant women, because this virus, for a lot of people, it's limited. They get fevers and dizziness, they don't feel well, but then they get better. But for people who are pregnant, they could potentially pass this along to their fetus, and we have seen fetal complications and congenital complications. And then, of course, we do say, you know, if you travel and return and have any symptoms whatsoever, do see a doctor, because I actually think this is underdiagnosed. You know, I do think more people might have it, but because it's self-limited and they feel better, they don't end up seeing a doctor. There's no testing done. So anyone who travels, definitely get tested, because there's other viruses that are similar, like dengue fever and yellow fever, and we want to be able to distinguish exactly what people have.
We were talking about this in the newsroom. Obviously, sloths are at the zoo.
Yeah.
So, is that transmissible?
Don't worry. Yeah, it's not sloths that are in the U.S. Of course, they get health checkups and things like that.
All right.
It's sloths that are in the wild in places like South America. So very few reasons to worry in the U.S. unless you're traveling. But in general, we need to be careful about interacting with wild animals unless it's supervised.
Right.
That's good advice for anyone.
Just for the record.
Yeah.
Yeah, no kidding. Yeah. All right. The CEO of drug maker Novo Nordisk appeared before Congress today to answer questions about the high price of 2 of its products. Lawmakers focused on weight loss drug Wegovy and diabetes drug Ozempic. Senate lawmakers argued that Novo Nordisk charges Americans substantially higher prices for the injections than it does for patients in other countries. In his testimony today, the company's CEO said the problem is not the price, but rather the complicated U.S. healthcare system. So joining me now is Dr. Natasha Bouillon, National Medical Director of One Medical. You know, this seems to be such an ongoing topic, really for years now with these drugs. It is sky high.
They're really expensive. And you know, the U.S. really is an outlier, because these pharmaceutical companies, they set the prices, and then your insurance company decides if it's covered for you or not. And so for so many people, it's hard to get access to these medications.
No kidding, especially when you're looking at, what, $1,000 or more a month?
Exactly. And you know, what I'm hearing from my patients is that they really want these medications. They are very effective at weight loss. They're effective at diabetes management. But for so many people, they're not covered in their insurance. And so when people pay out of pocket, it's more than $1,000 a month. That's out of the question for so many people. And then even when it is covered by insurance, people have to jump through hoops to get them. There's prior authorizations and so many other forms. And oftentimes people end up delaying even getting the medication. So it's hard to get access to these medications, which is so frustrating because they work so well.
And it almost sounds like it's discouraging.
It's discouraging for
a lot of
people,
these patients.
exactly.
Like, why, if I have to jump through all this, why?
Exactly.
So what can people do?
You know, there's limited options. So of course there's manufacturer coupons that will give some people a discount. There's other discount programs, so things like GoodRx or even like Amazon Pharmacy has, you know, discounted programs. It's a small discount. It still ends up being hundreds of dollars a month. You know, the other option people are turning to now, it's compounded medications.
Yes,
so
we've talked about that
before.
before.
So they're going to specialty pharmacies and they're compounding the active ingredient of these medications with other types of medications. Now, the FDA, they discourage people from using compounded GLP-1s because we don't exactly know the safety, we don't know how effective it is. But for a lot of people, it's, you know, a couple $100s a month to get it compounded. And I have some patients who are on it and they say it does work and they know what the risks are, but they're willing to take those risks to get much cheaper medications, which is a really tough decision.
Okay, let's get to another health story making waves today. Whooping cough is surging across the U.S. Case levels are now 5 times higher than they were at this time last year. The CDC says this is also the highest number of whooping cough infections since 2014. So why are cases increasing?
Going up. So multiple reasons for this. I think one of them is waning immunity. So we know that the whooping cough vaccine, it's really effective 1 to 2 years after you get it, but then the years after that, it starts to decrease in effectiveness. And for adults, we get it once every 10 years. And so we notice that the immunity is not as good. I think the other big one is that bacteria that causes whooping cough, it's evolving. Just like other bacteria and other viruses, they get smalt, they can evade our treatment and our vaccines. And so we're seeing that as well. And then of course, we're more active. We're getting back to pre-pandemic activities, social interactions, people are out and about, and of course that spreads the whooping cough as well.
It gets to become more contagious.
Exactly.
So what can people do to stay safe?
Yeah, so the number one thing is get vaccinated because of course that makes a big difference. And I always tell people this, stay at home if you are sick. Avoid work, avoid daycare, avoid school because that's where we spread this. Whooping cough is highly, highly contagious. And the other really important thing is see a doctor if you have symptoms. It's a little insidious because people will present like a typical cold and cough for about a week. And then after a week, they actually start to get that whooping sound. The cough gets really bad. Sometimes people even throw up from getting that cough. There is antibiotic treatment for it. So we want to know if someone has it so we can treat them. And actually, just as importantly, if somebody is sick, we can treat your entire household. So we can prescribe antibiotics for everyone in the household to prevent them from getting sick as well and spreading the infection.
And I'm just curious, how often should we get this vaccine? Who should be getting it?
Yeah, so right now, you know, anyone can get it over the age of 2 months. So definitely babies are at highest risk. When they get whooping cough, they have trouble breathing. They end up in the hospital oftentimes. So of course, children should absolutely stick to their vaccine schedule, get it starting at age 2 months. Teenagers get a booster at around 11 to 12 years. And then for adults, it's every 10 years with our Tdap vaccine.
All right, great to know. First up, 3 lacrosse players at Tufts University remain hospitalized with a dangerous condition known as rhabdomyolysis. A total of 9 players were hospitalized with the condition, but 6 of them have been released. The team says this happened after a 45-minute workout led by a Tufts graduate who recently graduated from the Navy SEAL training program. Tufts University is now investigating. Dr. Natasha Bouillon is back with us. Explain what rhabdo is.
So rhabdomyolysis, it's basically when the muscle breaks down after damage. And then that breakdown product releases things like protein into our bloodstream. That protein and other products can end up in our kidneys, causing kidney failures, seizures, and it's actually a life-threatening condition. People actually do die from this. We do tend to see it more in people like firefighters or other outdoor workers who are outside working for hours at a time, but it's a serious condition and people who have it do get hospitalized.
Okay, so this isn't something where, you know, because it's really hot right now, a lot of kids out on the fields, they're playing, like something that parents should be aware of.
It's extremely atypical to see it, you know, in children or people who are just kind of exercising regularly or playing outside. But of course, we do, of course, encourage people to stay very hydrated if they're outside. Only gradually increase your activity. Don't go really, really hard for lots of hours at a time. And of course, just try to avoid overheating the best we can. Interesting thing here, though, is most people who get rhabdo, it's usually 3 to 4 hours of intense working out or exercise.
This was 45 minutes.
It was 45 minutes. And so we can only speculate, but it must have been a very intense workout. We don't know if they're hydrated. And then the other thing that increases the risk of rhabdo is if people take certain supplements. And so not sure what was happening with this group, but it's pretty atypical.
Have you noticed how hard it is to get a doctor's appointment lately and how expensive they are these days? Numbers show it's becoming a more common occurrence nationwide. In fact, one study found a third of patients say they have not been able to see a doctor in the past year due to availability issues. And for those who were able to get an appointment, nearly 1 in 5 patients had to wait anywhere from 1 to 3 months to be seen, which is not only frustrating for patients, as you can imagine, but also doctors.
Right now, things are at almost crisis level and physicians are literally closing their practices. I think we're facing even a worsening problem in the future unless something changes.
So joining me now is Valley physician Dr. Andrew Carroll, Senior Medical Director for IntraCare. Dr. Carroll, this is so frustrating. And I noticed even for myself personally, when I was trying to book a dermatologist appointment as a new patient, I mean, I literally was looking at least 3 months down the line. Why is it taking so long for not just new patients, but current?
Yeah, I mean, when I get new patients in my office, they sometimes tell me they were waiting 5 to 6 weeks for a new patient primary care appointment. And it's because there's so many people are rising into those Medicare roles. They're passing 65 and they're needing more and more medical care as they go. So like the dermatologists like you're talking about, here in Arizona, dermatologists are probably some of our most busy specialists here. We got a lot of sun, which means we probably got a lot of skin cancer. And those folks are booking out 3 to 4 months, absolutely.
Yeah, it is ludicrous. I mean, really. So are you seeing this problem? We talked about how it's a nationwide problem, but are you seeing this problem here in Arizona a lot?
Yeah, you would think like Phoenix Metro, Tucson Metro, we wouldn't have a problem like that, but we absolutely have a problem. I mean, we have an even bigger problem in our rural areas like Kingman and Flagstaff and Nogales and these other places where availability of healthcare is really scarce. And these folks are having to drive 1 to 2 to 3 hours just to get to an urban center to get the kind of care that they really need.
Yeah, it's got to be, I mean, if it's bad locally, it's even worse in the rural towns, as you were saying.
Absolutely.
Okay, so what is a patient to do? Give us some good tips.
So if you are trying to get a specialist appointment, work through your primary care physician. That's your best point of contact because that doctor will probably be able to steer you to the specialists who have more availability. They also will be able to pick up the phone. If you have an emergency condition or an urgent condition that needs that attention quickly, we're often, my staff or even myself will pick up a phone and call that specialist and say, can you see Mr. Smith? We need to have him seen within the next day or two, and we'll be able to do that for you. So the most important contact you have is your primary care physician.
Okay. You also say, you know what, it's not a bad idea to see the nurse practitioner or the PA, the physician's assistant.
So if you've already established with an office, especially a primary care or a specialist office, you've already seen the doctor and you need to be seen for something else in between. A lot of times a PA or a nurse practitioner who works with that doctor can see you in between. And if that person needs to contact the doctor, they can walk down the hall and ask the question. But it's a lot easier in most offices to see a nurse practitioner or a PA on a more urgent basis.
Okay, some people, myself included, worry, am I getting the same quality care though if I see the PA versus my primary?
Well, I hope so, and I hope if that PA or the nurse practitioner working with that physician knows what that doctor would do. But again, if they have a question or even you have a question, can you go ask Dr. Smith what he thinks?
Okay.
And a lot of times they'll come down the hall and take a look.
Okay, that's not terrible bedside manners. All right. Okay, I have to ask too, you also talk about setting up virtual appointments. That can be helpful. And again, I kind of wonder the quality of care.
One of the best outcomes of COVID-19 in terms of medical practice is the availability of virtual services. Governor Ducey put it in place where it was legal and also at parity that people could see their doctor virtually just as if they were seeing them in person. And that has carried over. So most doctors' offices have the availability of virtual services even after COVID.
One tip that I really like that you said, list out your 3 top concerns, because a lot of times people go in and then they lose sight of, you know, the main issues or the problems that they have, and then next thing you know, time's up, gotta go.
Put it on a notepad on your phone or bring it on a sticky, whatever you have to do to list your top 3 things that you must cover. We'll try to cover everything, but if we can only cover the top 3 things, at least you got to those top 3 things.
I like that you say get your wellness exam. That's very important. But also, let's just say that, you know what, it's taken too long to see the doctor. You want to start shopping around. What should we do?
We spend much more time on a wellness visit, so make those wellness visits. We'll give you the time that you need. If you have concerns about not being seen on an urgent basis, call the doctor or talk to the doctor the next time around and tell them what you've been feeling before you shop around. Give them the opportunity to fix what the problem might be.
All right, great advice. Dr. Andrew Carroll, great to have you once again.
Thank you so much.
Thank you.
A new report, though, released just yesterday, finding the number of women dying from the disease has dropped significantly over the past 35 years. But guidelines continually change, and we want to make sure that you are staying healthy and staying informed. Dr. Sonal Harder with Dignity Health is here to talk stats and the new recommendations. Dr. Harder, thank you for coming in.
Absolutely.
We certainly appreciate it. So let's talk first about screenings for women. They can vary by age and time frame. So what's changed?
Correct. So basically, these recommendations for average risk women, not for high risk women. And there are 2 forces, American Cancer Society and United States Preventive Services Task Force, Little bit of differences, but everybody and experts agree that screening should start at the age of 40 annually until the age of 75. Now, 75 and over, if you have a healthy patient, a healthy woman with a 10-year survival, they need to continue with those screenings as well. Okay. So those are basically recommendations for healthy average risk women.
Certainly. And when we talk about the new recommendations, we also need to be considering the dense breasts. That can play a factor as well.
Correct. And Rachel, you're so right. The recommendations for that have changed in September of this year. And what FDA recommends is mammography facilities are now mandated to report on density. Why? Because the more dense your breast tissue is, your risk for breast cancer is high, as well as cancer can hide in these dense breast tissue. So if you have grade 4 or D, as we call dense breast tissue, you may need additional imaging besides just a screening mammogram.
And something we talked about, I know we say that 40 is the age you need to start considering doing it annually, but if you're doing those self-examinations at home, which you should be doing, you can ask your OBGYN about doing that. Can you push to get an MRI or a mammogram?
So if you have high risk, and what is a high risk? If you have family members, first-degree relatives, if you have self-history of breast cancer, or if you're positive for certain genetics like BRCA1 or 2, then you definitely need to consider screening earlier than 40. And this is a conversation. We were just talking about doing a breast cancer risk assessment tool for all women to know what the risk is.
I know the women here in the studio said send it to us via email. Yes. We want to fill that out, and if you're less than 20%, it's okay, but just make sure that you're taking the steps to make sure you're protecting yourself. Now, let's also talk about breast cancer among men, because Correct. Some people don't understand that that is very applicable.
Correct. Although the risk is less, so about 500 men die from breast cancer each year, as opposed to over 42,000 for women. So we don't have screening recommendations for average risk men, but high risk men, yes. So who are high risk? Again, family history of ovarian cancer, breast cancer in first degree relatives, somebody who is having symptoms or somebody who's positive for certain genetics need to consider screening, including imaging and exam from their doctor.
Absolutely. And like most, cancers, there's risk factors involved, and a lot of them are stuff that we hear all the time, but let's talk about some of the risk factors and what we can be doing to stay healthy now.
So here's what I want all our audience to know is about 5 to 10% is hereditary, meaning 85% actually have no family history. And this is a common myth I hear in my practice that I don't have family history. 85% cancers happen in someone who does not have family history.
Yeah, you're the start of that unfortunate hereditary
Correct.
gene. Yes.
And some other risk factors are sedentary lifestyle, obesity, excessive alcohol use, smoking. As we get older, the risk goes up, and being a gender, like female gender itself, is a higher risk. Radiation to your chest, and so many others, but these are the main ones.
Absolutely. And I know, October, obviously we talk about it more and more, but it is something that people should be mindful of 365 days
Absolutely.
a year. And I know you're here today on behalf of two of your dear friends. Thank you. I know it's a topic close to your heart, so thank you for being here. And tell us about the fuzz briefly, just about Jen.
So one of my girlfriends who actually passed away from breast cancer, diagnosed under the age of 40, no family history. She loved Forrest. So this is
a nod to her. Yes. Well, thank you for sharing that with us, Doctor, and thank you for all the great advice.
Thanks for watching. Be sure to follow our YouTube channel for more content and watch the Ask the Expert segment weekdays at 4 p.m. and right here on our 12 Plus app.